Go.
Hi guys, it's Dr. Jenny over at Forepaws Fulshear Veterinary Clinic, and Maddie and I are going to be chatting today about everything you might need to know about senior dog care.
Dr. Denny, what is the most important thing to know about caring for a senior dog?
I think the biggest thing that we need to be aware of is that age is not a disease. I have a lot of clients that come in and say, well, he's just getting old. I'm like, well, okay, you're not wrong, but with age comes certain conditions. So arthritis and organ dysfunction, sometimes behavioral changes we can see. So there's a lot of things that come along with old age that we need to be cognizant of or conscious of. That way we can address them.
What is the life expectancy of a dog?
So this is where I would totally give you a crystal ball. And if I could tell you how old your dog would live, I would 100% do it, or cat. And I would use it on myself too, because I love my animals. I don't have kids, so my animals are my babies. But I will say that larger breed dogs tend to not live as long as smaller. So like on our giant breeds like Great Danes, Irish Wolfhounds, large dogs like that tend to, tap out around 10 to 12, sometimes even sooner. Like I've lost them, at 7 to 10 before. Medium-sized dogs or regular size like Goldens or Labs, Golden Doodles, anywhere from 10 to 15. As the smaller we get, the longer they tend to live. So like my teeny tiny little bitty Chihuahuas, my little cheese, they can live to be like 16, 17, 18. I mean, we have one that we see, I guess I'm not going to call her out on this video. I think she's fueled by internal hate. And that's why she keeps going. Her mom and I laugh about that all the time. But certainly my more spicy patients do tend to live a little bit longer, but that's the best I can give you.
How does getting older impact the health of my dog?
So we start to see arthritis, which can show up on slower to get up, to get down, limping off and on. We can see changes in appetite, changes in cognition, like older dogs can get cognitive dysfunction, like doggy senility, and they'll kind of stare off into space or get lost in the house or circle or just pace. Sometimes they can't get comfortable. We can also see internal organ dysfunction, so liver, kidneys, gallbladder, everything that humans can get, dogs can get. So as they age, we really want to be paying attention and running those blood works every year to try to catch things before they become major issues.
How can wellness care extend the life and vitality of my dog?
Well, because if we know what's happening, so if I see your dog once every 4 years, okay, we have to remember that almost every year for a human, 365, their bodies are aging around 7 years. So if I don't see your dog but once every 3 years for a rabies vaccine, that's 21 human years basically that their bodies are aging, that they're going without care. And we're very focused on preventative medicine, which means seeing your dog every year, if not twice a year, and doing preventative lab panels to catch these diseases. So wellness is important because that's how you stay well. I mean, that's literally in the name, wellness. It's great, going to the doctor is not fun. I'd say as I get older, I've got, I used to maybe see my eye doctor once a year, and now I'm in my late 30s and I have like 7 different doctors. I don't know if anyone watching those videos feels that, but as we age, it's more important to go to the doctor because our bodies start to change, and it's important to catch those changes.
What are the most common problems in senior dogs?
I would say arthritis. So we can see muscle atrophy, muscle weakness, limping. Maybe we don't jump on things like we used to, or we jump and we miss. Hesitant to do things that we used to do. So arthritis is a big one. They can get aches and pains just like we can. And then the other one is organ dysfunction. So liver, kidney disease, pancreas disease, gallbladder disease. And then last is going to be cognitive function. People don't think about their dogs getting senile, but it absolutely happens. And guess what? There's things we can do to help with that. I like to watch Wheel of Fortune. I don't know anybody else that does, but I know there's that, what is it, Prevagen? It's like a cognitive support for people. So why would we not do for our dogs what we do for ourselves?
Does my dog still need regular wellness exams as they get older?
Yes, because that's how we find things. That's how we know if things are hurting. I can't tell you how many times I have a client come in and I find, that, oh, well, this joint has reduced range of motion. Oh, they're really fighting me on flexing this ankle or this hip joint or this knee joint. And the owner's like, well, he's not in pain. He doesn't tell me anything. He does everything at home. And I'm like, well, it's my job to make the joints bend the full range of motion and find the pain and know that, hey, if something is hurting, they're going to change their behavior to guard that joint. And maybe it might be so subtle that you don't pick up on it. It's my job to find that for you. And how are we going to do that if I don't see your pet?
What are some signs and symptoms that my dog may be slowing down?
So, they could actually slow down. If you have a Vizsla who's cocoa nuts, they're crazy, have a lot of high energy, and then you start to notice that this pup that used to play fetch for hours, maybe only goes and wants to get the ball twice. We're literally slowing down. So those are things to look for. Changes in behavior. Did we used to go for long walks and absolutely love it, and then all of a sudden, we make it once around the block and they sit down and they're looking at you like, please, dear Lord, don't make me do this anymore. So we have to pick up on those changes of behaviors.
Why is it important to avoid self-diagnosing if my dog is slowing down or whether they are actually sick?
Because what if you're wrong? If sometimes we'll run this preventative blood panels or run lab work annually, and we'll find things like liver disease or kidney disease. And, my owner would say, well, I just think they're getting older. And I'm like, no, there's actually here's a problem. And there's actually something we could do to fix this. And we fix it, and then all of a sudden their pet, this dog, gets a whole new lease on life. So if you're diagnosing your own pet and you're wrong, we could be missing major things that are treatable and fixable. And who wouldn't want their animals, their pets, in their end stages of life and their last stages of life to have the best quality of life that we can give them?
What will my veterinarian be looking for when examining my senior dog?
Everything. And by that I mean heart, lungs, nerve function, musculoskeletal, abdominal pain, masses, tumors, arthritis. I'm looking for muscle atrophy. So it's a physical exam. We check lymph nodes. It's from nose to tail. And so we look for everything. All right, guys, so I hope this helped answer some questions you may have about senior dog care. And if you do have further questions, or if you think that your dog is slowing down, maybe we should make an appointment and let's find out why. Maybe there's something we can do to fix it. Thank you.